Hey everyone, and welcome to the AgeTech Connect podcast, where we dive deep with innovators, entrepreneurs, and industry leaders to figure out how technology can make the world a better place for older adults and those that care for them. In this episode, I'll be speaking with Liz Cramer and Sheri Rose. Liz and Sheri share their expertise from their time with the Thrive Center and CDW to give both innovators and operators practical frameworks for creating and adopting innovative technologies to solve the most pressing problems in senior living and post-acute care. Liz, Sheri, welcome on to the AgeTech Connect podcast. How are y'all doing today?
Great. Thanks for having us.
Yeah.
Now, I will say y'all are my first ones that I've done with three of us with two guests at the same time. So it'll be a little bit of a guinea pig situation here.
We're used to working together, so we'll wait for each other and we'll chime in when the other's through. So
You've been around the AgeTech Connect space for a long time, and you guys kind of like the dynamic duo of this senior living post-acute care. Like, I don't know that I've ever seen y'all do anything separately on your own. How did y'all get to become the dynamic duo that you are?
it's interesting because when we were created in 2017, CDW was there. And so they believed in our mission and what we were trying to do as we were establishing the Thrive Center. They've always been at the table with us, which has been awesome for us as a nonprofit because they bring a lot of technology value to the center and helping us redesign. They keep up with all of the trends around AI and technology because it's constantly evolving. So we work very close together.
Could you guys get a little bit into your backgrounds before we start jumping into, Thrive Center CDW? I know that's what both of y'all do, but how did you guys get into that line of work? How did you get into age tech in general? What drew you into the space?
Actually, I went by way of tech. However, my degrees are in psychology.
Hmm.
So you consider merging my passion for people with tech, and that brought me here to being a co-founder of the Thrive Center. And now's the CEO of the Thrive Center, which I guess I've always been the CEO of the Thrive
Mhm.
Center. I thought I was meant to create it and then leave it, but now I've been the CEO since we opened. But I had a long career with Bell South AT&T, and so I had the GEM market, which is government, education, and medical, and responsibility for putting all the network in place that connected to the repositories at the state and the registries around healthcare. So once I left there, I thought no one really cared about the network that I put in the ground or in the air, cellular. It was more about the applications that reside on the end of that network and giving people access to those applications. So I started to launch into more software and population health management. I was doing consulting, working around population health management, and that's when the opportunity came up through some economic development funds to establish what was termed a simulation lab around aging. I didn't want to call it a lab. My psych background told me that no one wanted to be part of a lab and be an experiment. So we changed the name and we came up with the Thrive Center because it should be about living and thriving, not aging and dying.
Nobody wants to see a lab rat.
Exactly.
Liz, how about you?
Well, my background is in the senior living space. So I am a PTA by background. Great career. I spent 20 years working in the senior living post acute space prior to joining CDW. Most of that time was in leadership roles in the therapy world. And I was very lucky to work with a lot of great operators and providers that taught me a lot about the business. And prior to CDW, most of my time was in a regional vice president of operations role for national therapy operator. So again, therapy is a very integral part of what happens on a senior living campus and in the post acute care world. So I was really lucky to be able to, again, learn a lot about the business. And so when this role with CDW came up, then I started to learn more about the technology. My background knowing the workflows of senior living, post-acute care, the differences in what they are versus what happens in the hospital, which are very different, allowed me to kind of jump into this role and then, start to learn about the technology side and, look at technology from a little bit different lens. Not coming from a technology background, I looked at it more from, if I was a clinician, is this something I would want to use? So I've been very lucky to, as Sheri said, we spend a lot of time together. We look at a lot of technology together, and she's taught me a lot about the world of technology, but also just, being part of CDW. It's just been such a great ride to the last 5 years to be able to do this.
Yeah, I think it's so cool that y'all have paired your expertises up because you kind of operate on opposite ends of the senior living innovation spectrum. Sherry, you're more involved with getting that innovation out there, fostering the innovators, creating the next new products. And then Liz, you're on more of the buyer end, helping people figure out the how, when, why, and where of implementing these new technologies. So while I want to cover the whole spectrum today, I want both of y'all to speak to a little bit the importance of connecting these two ends of the spectrum. And maybe we could frame it in terms of what goes wrong when there is a disconnect between the innovator and the end consumer.
We do a lot of work, Daniel, with startups, and many of them who get grants, National Institute on Aging grants, and they could be $2 to $3 million. And they all come with an idea. And Liz and I laugh about it because everybody's trying to solve from an experience with their grandmother or grandfather. And having been a caregiver myself, I put my caregiver lens on it. Lost a father to brain cancer, lost a mother to Alzheimer's disease. And I always look at those products in detail to think, is it really going to work? And so many times it becomes part of a commercialization strategy. And that's what we do really for the National Institute on Aging. They want to make sure if they give a company $2 to $3 million grant, that they're going to be successful and that they enter the right market and that it's priced appropriately and that they understand their competition. And so we walk them through that whole marketing strategy before Liz picks up, and then they have to implement what they design. But, the other thing that we talk about is you have to be a good steward of investment dollars.
Mhm.
And by being a good steward, you need to know what's the market I'm going to enter, what's that entry point, how do I price it right out of the bat, and then to also know that if I have to pivot, I'm going to pivot early. If I'm going to fail, I'm going to fail early because you do not want to take a product down the road and spend a lot of investment dollars and watch it fail at that point.
Yeah, I love how you pointed out a lot of these innovators are coming from a place of passion, from a place of personal experience. And that's like what gives age tech and this realm in general, health tech, med tech, it gives it a lot of passion, it gives it a lot of life, but it can also kind of be the Achilles heel of early stage founders for a lot of these innovations because they care so deeply about what they're solving. They feel so strongly that their solution is the right one that sometimes it's hard to make them like help people realize well, this is a business as well, right? At the end of the day, somebody does have to buy it, no matter how important your mission is.
And team is extremely important
Mm,
because we've seen developers that they don't want to let go of their baby. They want to run the company, and they may not be, although they develop the product, they may not be the best qualified person to run the company. And some of the more successful companies that I have seen, they have the developer has stepped into the background, even as the founder, and they've continued to develop and let someone else come in and run the company.
And I just add to Daniel that, as Sheri said, age tech space is very much about passion. And as you said, a lot of startups are so passionate that their solution, their product is the best, even when there's multiples of them out there. So we always recommend, one, do you understand who your competition is? Because again, they're so passionate about it because it happened to a loved one. But then also understanding the business that they're going into. As I said, senior living, the post-acute space, senior living, they're paid very differently than a hospital. There's segments of it that are CMS governs and insurance covers, but a lot of it is private pay as well. And so understanding who is actually paying
Hmm.
for the product and the solution coming in is very important as well. And many times we see that that's not the case with startups coming into the space because they don't understand the process, the payment system, and how the workflows are.
Yeah, I imagine you see a lot of folks that think they'll just get by on the passion and the idea alone, right? Like it should just be
Mm,
enough that this product helps the older adult or the caregiver or whoever it may be. I don't need to
right.
worry about the payer thing. I think I find a lot of innovators almost feel like it taints the mission if you start, talking about, oh, well, who's going to
Mhm.
pay for it and could somebody afford it? I'm going to start charging people for this, right? Because I feel so passionate about that mission.
Yeah,
Yeah. I mean,
absolutely.
I always tell this story because I think sometimes startups look at the cost of care. That's
Mhm.
a big market. I had a startup one time tell me he thought his market was skilled nursing because they have all the money. And I'm like, they do not have all the money. That's not your market. They don't have any money and never equate cost of care with profitability. And so it's understanding that market that you're trying to sell into, and as Liz said, in a highly regulated market, how much information is too much information? And how are they going to pay for it? Because they are skilled is so highly regulated that they've got to meet all the compliance standards. And if you give them too much information, that may not go well with compliance officers. There are many states, people don't realize that in highly
Oh,
regulated
excuse me.
environments, they are targeted by attorneys where maybe you don't have tort reform within those states, as is the case with Kentucky. Well, all the litigation goes into the price of a bed as well. And so to keep those costs down, they're going to do what they have to do and avoid any type of litigation. So you give them a lot of information because you're passionate about the care for that loved one. It's just open for an attorney to come in and subpoena. You hate to think that way,
Mhm.
but the reality is it does go into the cost of a bed, and we have to keep it affordable for aging adults and do the best we can with the technologies that we had.
Yeah, because no matter how good your mission is, it's not going to impact anybody if nobody actually buys it or implements it. You've talked about a lot of the qualities of an innovation, a team putting of innovation forth, such as, who's on the team, do they know their right market? What are some of the other things that you see innovators or entrepreneurs do to proactively bridge that gap between their innovation and actually reaching that consumer?
I would say scale, wouldn't you, Liz? I mean, I always say if you can't scale, you'll fail.
Mhm.
I think that's the value of a CDW that can help scale you, but they can't do your manufacturing for you.
Yeah. Senior living you have large operators, from 50 to 100 to hundreds of sites. And then you have some operators that are maybe one or two sites. Those operators that are one or two sites can be much more nimble when it comes to new technologies versus those that have that multi-state, multi-campus portfolio. And, when you get into those larger operators, there's a big focus now on standardization. As they're looking at technologies, they want to have this same technology on all the campus. They don't want every campus kind of going out and finding their own piece of technology for falls, for instance. As a startup or as a age tech company, you really need to be able to, be prepared to scale. I mean, if it's a company that really is solving a problem and challenge in the space and operators want to work with you, you've got to be able to scale and reach multiple sites at the same time. And also be able to say, which is sometimes hard, this isn't something we do. I think Sherry would probably agree. Whenever we start asking questions and the company says, "Oh, yes, we can do that." We're not doing that right now, but we can do that. That's always a red flag from my standpoint, because if the answer is always yes, chances are it's probably not a good plan.
That is very true. What Liz is saying, selling to a multi-site is very different than selling to someone that maybe has two communities. Pilots, we get a request from a lot of companies on, would you pilot? For me, a pilot is a partnership. And you have to shake hands on that's exactly what it is. It doesn't mean we're going to roll it out, but we're both going to learn from it, the organization and the startup. And what we will say to the organizations, don't take on a pilot and help them fail if you are prepared to help them deliver on that pilot. So that's going to require a champion within the organization and to realize that it's exactly that. It may not work the way it came in, it may be changed multiple times. But what gets exciting to us is when one of the organizations has adopted a pilot and then they've rolled it out and now it's become a paid product. And that's really what you intend it to be. And, that pilot may be covered by a grant, but the object is not to just do it through a grant, but to roll it into actual commercialization and now be paid for your service.
Yeah, because I was originally talking about, how does a really early stage innovator target the right market? But what I'm hearing from y'all is that this is an iterative process throughout the development of the company, right? There's one thing to come in with your idea and say, well, this is where I think the market's going to be. And that can even be a really good guess or a really good target. But it seems like that as you scale, as you get bigger, you need to be constantly reacting to what your consumer is saying. And Liz, I think it was a really interesting point you pointed out, knowing when to say no. So I want to touch on that between the two of you, where how do you navigate that space of, yes, I want to listen to the customer and make sure that I'm providing a product that the customer wants, while also being able to say no to the customer and saying, I know you want that, but that's not what we provide. How does a scaling entrepreneur hit that mark down the middle?
When we're thinking about that scale, it's always one of those you don't know if you don't ask. So, as the operator, they may see that a pilot's going really well. And so, my next question is, well, could you do this? And unfortunately, if you say yes and it's not something you do and that fails, that's not going to be good for the company. So I believe that, you have to have understand where your lane is and be able to say to the customer, this is what we do and we're going to continue to evolve what we do, but what you're asking right now is not something we can do. And I think that as a prior clinician and someone now that's always looking at technology, I can respect that more than if someone says, "Yeah, we can do that," and then it fails spectacularly.
Know your limitations.
Mhm.
Yeah.
And on that thread, I mean, in the Thrive Center, you guys help innovators come forth and navigate this process. What are some of the tips you give scaling entrepreneurs on really how to narrow down on that lane and to not get distracted by these extra things? And specifically looking for those real practical tips. What are the practices that an innovator can put into their daily growth that helps them hit that target the right way? Because it can be really nerve-wracking for an innovator to be facing a customer for the first time and think, "Oh, well, I gotta say yes to everything," or "Is this the right lane?" or "Am I in the right spot?" or "Is this the right pilot?" Is there so many unknowns? How do you guys help young innovators navigate that?
Walk before you run.
Mm,
And they may ask you a lot of questions, as Liz said, that it's okay to say, I don't know, or we're not doing that yet. It may be on our strategic roadmap, but here's where we're going to start. And then to also compare yourself to what other products are out there on the market that may be in your lane. And so we look at some markets where products, it's a very saturated market but you have the opportunity as a innovator to differentiate yourself from the market. We have a lot of products here at the Thrive Center that Liz would tell you there's a little bleed over. So don't fear that person who maybe is in that lane with you, but you may do it a little bit differently than how they do it. Your reporting function could be different, or the way you collect the data could be different. And so I think you just have to know that competition and how you're going to differentiate yourself for them. It's a big market out there, and there's room for everybody if you can deliver on what you say you can do. The worst thing you can do, like Liz said, is to say, yeah, we can do it. And then you fail. You're not going to scale because they're not going to ask you back. And we always tell the senior living organizations as well, before you sign a contract with someone, know if they have an exit strategy. Because a lot of these companies take investment with the idea that they will exit at some point. But what's going to happen to you? If you're the one that purchased that product and now they have exited the market, how are you going to navigate through that process? Are you going to be there and handhold them through the transition? And a lot of that, I think, needs to be written into the contracts that are signed, because we've seen a lot of exits and we've seen products. I've had products in here that I can't use today because they're not compatible with our technology. Or when I have a question on that product and I call the company who acquired the other company, they can't seem to handle the support issues, and so they're gonna fail then.
And that's a really good transition to kind of the next half of this equation where, even if an innovator takes their idea and brings it into the market, and there's a lot of great innovations in the age tech space. If you're on the side of the senior living or post-acute care operator and you're trying to navigate this sea of possible technology solutions, I'm sure it can feel like trying to find a needle in a haystack. So what do you guys, because I know you guys operate on that end as well, what is your advice to operators when trying to navigate this sea of potential technology solutions to get something that really sticks?
I usually start with what is the problem you're trying to solve
Mhm.
or what is the challenge? And let's narrow it down. We don't want to boil the ocean to start with. We know that there's lots of challenges when it comes to workflow and efficiencies, and we know that there's major staffing concerns throughout healthcare, but specifically in the post acute senior living space. Operators are always looking for, and providers are always looking for staff. So, again, making sure that you're really focusing in on, okay, let's start with what challenge or what's going to make an impact. So, for instance, just example, we had an operator that came through Thrive, looked at all the technologies. There's a number of things that they were thinking about, from smart home to falls to remote monitoring, et cetera. And as Sheri said, there are some companies that we have that overlap, but when we finally kind of broke it down, it was like, okay, what's something that is going to have a big impact on our care staff, a big impact on resident satisfaction, and we're going to move that needle early. And it was on looking at trying to automate resident check-ins, which, when you have lots of campuses, it can take up a lot of time every morning making sure that check-ins are done. And so if that's something that can be automated, residents don't like having to, whatever it is, if they have to hang something outside the door or push a button or what have you, staff have to automatically walk around and check those things out. And then, potentially front office staff or front desk staff have to spend time then calling those that didn't meet the check-in. So if those can be automated, that's a quick win for staff and residents and the whole campus. So that's where we usually start, is let's not boil the ocean first. Let's figure out how to get a really impactful win for both staff and residents on the campus. And then let's grow from there because they'll see that the technology is helping and then start to ask for more.
You kind of touched on something interesting where I always think of product market fit from the product to the market side. But I guess if you're a leadership in or an operator in one of these senior living communities or post-acute care facilities, you probably have to do the same thing. You almost have to do some internal research to discover what are my problems? What's the biggest thing that's going to move the needle for me? Do you find that there's some parallels between the entrepreneurial process of product market fit and the operator process of product market fit?
Absolutely. From the organization's perspective, one of the biggest challenges is workforce staffing. And we look at the shortage of workforce, and all the economists will tell you with the baby boomers, we will outpace the workforce 3 to 1. So if you aren't focused on those taking care first, as Liz said, those mundane tasks, the things that you have to do, taking that burden off of the staff that frees them up to care for the residents. And, with artificial intelligence, typically that's where you should start. How can you use AI that can really take some of those tasks that you're doing every day and do those tasks where the staff's not having to do it? And so that's a great place to start with artificial intelligence. And then now you've freed up your workforce to really do what they got into the business to do anyway, and that was to care for the residents. I do think they look at it from different perspectives, but at some point they meet in the middle and they realize how they're going to implement that technology. And is it something that's a nice to have, or is it something that, yes, we really need to do this because of augmenting the workforce?
From the entrepreneur standpoint, the startup standpoint, as you're talking to operators, listen to what their problems are. Don't go to them with, I can solve your problem. Go to them and listen to what they're actually telling you versus trying to tell them what their problem is. Because again, a lot of times, as we said earlier, these startups, they come from a place of passion. And so the thought process typically, which isn't wrong, is that if this happened to my grandmother or my grandfather or my loved one, it's probably happening to other people's loved ones as well. That's not incorrect, but I believe it's really important. You're out there, you're ready to start having these conversations. Just make sure that you're listening versus telling that senior living operator what problems you're going to try to solve.
No one wants some young entrepreneur walking in, or it could be an older entrepreneur, but walking into an organization as if they know all about your business. And even if you do, the listening part of, I want to know about your business, let them tell you. And that's what creates that handshake and that partnership, because sales are done. I've been in sales most of my career. Sales are done on a trusted relationship. And to know that I'm going to be honest with you on what I can do, what I can't do, I'm going to handhold you through the process, and I'm going to escalate when it needs to be escalated. And if I do exit the market, I'm going to make sure that you're taken care of.
Mhm. Do you guys find that there's a similar attitude? So we've talked about the entrepreneur approaching the operator. Do you guys find there's a similar attitude with the operator approaching their residents or the families of their residents, where they bring in some technology solution and they say, oh yeah, we know this is what you guys are struggling with, we put a camera in your room, or we have this new thing that helps you manage your medications, and it's really not a need that moves the needle for their seniors or their residents or the folks that care about them.
We always say engage your residents. They should be a part of it. Even here, because we do see a lot of products that are more business to consumer as well, and the private pay side of it. And so I've got a product sitting here behind me, but I created a consumer technology committee of adults who were retired nurse practitioners, and they love that sense of purpose that it gives them and to give us some feedback. But that's also important to know that, hey, this consumer is not going to use that, and here are the reasons why. And so that helps the innovator adjust and pivot. But, Liz chairs our technology steering committee because it shouldn't just be me looking at products. And a lot of times, Liz and I'll toss them back and forth because they're too small to be in CDW's portfolio. And Liz can tell you about that process because they're not going to take you in unless they know you can deliver. But here I work with a lot of them that aren't prepared to go to CDW. And so when you walk through the Thrive Center, not every product in here is in CDW's portfolio. But I will tell you, they take those products to the market for that company because they're a trusted advisor to the organizations that they work with. And they know the products that Liz sees, and they'll bring their clients in here. And so it's extremely important to get other eyes on the product. And Liz, you might share some of what you do with the tech steering committee.
We're on our second iteration of Thrive, and I'm, you know, very lucky that I got to be part of this second iteration. And so Sherry and I really wanted to make sure that in the new space that it was very purpose built and that we're changing out the technology as appropriate. So we brought together a group and its operators. So Sherry and I are part of the committee as well. But as part of the group, we have two CIOs, we have a SVP of operations, we have a chief clinical officer, we have a VP of therapy services as part of that group that will be our tech steering committee. And they were here in April for the kind of that first visit and provided some great feedback as operators, made some suggestions as far as where we had some of the technology. And it was like, that's not something we would probably anyone on it on our campuses would buy. So we kind of moved it back to like the consumer corner that we have. One company that we'd been working with, a few of the operators had made the decision to move that company out of their campuses. So those were great conversations for Sherry and I to hear because I mean the operators, that's who we're here for. I mean, yes, community members as well want to come in and see if there's technology that can be used in their homes, but ultimately the seniors living on these campuses, these are their homes too. This is where they live. And so, having that feedback from the operators has just been fantastic because it helps Sherry and I kind of see like, okay, where do we need to pivot as we think about new technology that's coming in?
And gaps. What have we
Mhm.
missed? What do we need to cover in here? Because, I think what's important to us, Daniel, is the people that walk through our doors, the clinical staff, the CIOs, and they come from all across the US. We want to be a trusted source for them, and we don't want to mislead them. We don't sell out of here. As a nonprofit, I don't quote any prices, but we refer out. And so we give exposure to a lot of these products, but we want to make sure that we're on the best in class level. And so these are the products that if we had to recommend you take a look at, we would say you probably need to take a look at these products. But technology is changing all the time. What you see in here today, you may not see a year from now, and you may see a lot of products coming in. So that's why we have a lot of repeat visitors that come through. Liz, how many years have we been doing this? And CDW, you bring a lot of your clients through that have been in here multiple times now.
Yeah. So in the new space, we have, lots of customers that visited the old space, but I mean, we've just been open a year. And, we've had customers that have been here multiple times already. And when they came back the second time, they're like, oh, well, this wasn't here when I was here 3 months ago or whenever it was. So, and we're always updating as well. So it may be that, we still have the same technology, but they've added something to what they're doing, or they've evolved their platform. And so we've brought that evolution into Thrive so they can see what it is and how they're continuing to evolve.
Liz will bring in an organization that maybe just the CIO comes. And then the next thing you know, all their leadership team is here.
Hmm.
And then the leadership team says, I need to bring my clinical staff in here. And so that's kind of the way that it works, because that operator may not know what that clinical team would really be willing to adopt. And so it becomes a team approach. And we've seen that work extremely well.
Yeah, I was going to go into because we've talked a lot about how do you find the right technology, but it sounds like that's a major key to making sure you keep the right technology. Because I know a lot of operators that they find something really good that, maybe the chief innovation officer, the CEO really liked, but they didn't really get buy in from their whole company. And then when they bring this tech, or even from the residents, and then when they bring this technology in, it just kind of flutters out, right? Do you find that that's a major key to making sure the technology, one, comes in, but also sticks, is getting everybody involved?
I think the key, and
Absolutely.
Liz, you would probably say this, the key with CDW's events is they get to be in there with colleagues from other organizations, so they share.
Mhm.
And I think that's been extremely valuable, where they hear from their colleagues that are running other senior living communities.
Yeah, I would agree when it comes to the events, Sherry, for sure. And Daniel, I'd say from an operator kind of choosing, we've seen this kind of major evolution in technology over the last 5 years, when it's everywhere, but specifically in the senior living post acute space. And the role of the CIO or VP of IT has changed dramatically, compared to what it was even 5 years ago. And so it is very important. The ones that we see that are successful are looking at technology as a team,
Mm.
and they've got clinical involved, they've got operations involved, they've got IT involved, because coming from that clinical operations background, if IT were going to come to me and say, hey, we chose this for you to use as your fall prevention or your fall detection technology. Well, did you talk to clinical and operations about this technology before you decided we were going to implement it? And if they didn't, chances are it's not going to be successful. But if it's chosen as a team and clinical agrees, operations agrees, we've talked with residents and residents' families about why we're choosing this and why we're bringing it in, and then have a plan for that implementation and rollout, it goes so much better. There's always gonna be opportunity to improve. That's part of the benefit too of our CDW events, because as Sherry said, we bring operators in kind of peer to peer. They can talk about how they implemented things and what went wrong. Here's what we do different. Hindsight's always 2020. If we were doing
Mm.
this implementing now and we knew what we know now, it'd be a lot easier. They get to learn from each other, but having that team or group dynamic of choosing what technologies to bring in is so important, because that's where you're going to get your buy-in from everyone and it's going to be successful.
Yeah, I've heard kind of throughout this whole conversation that really the key to all this is just getting everybody involved, whether you're the entrepreneur, the innovator, the operator, the resident, right? The more people that you can have together in creating a solution that solves a problem for the older adult or the caregiver, the better. And I love just the cyclical nature of that, right? Just get everybody in the same room and talk it out. I love that Thrive Center provides a space for that, right?
We do. We can accommodate 75. Today we have 45 people across the hall, and it's one organization in multiple states. And they brought all their leaders in, their executive directors from all of their communities. And so they're in there doing strategy sessions, tour of the Thrive Center, and they're going to be here. They started today. They'll be here all day tomorrow and a half day on Thursday. So they're taking advantage of pulling all of their leaders together and focusing on innovation. Who are they competing with as well? And them being prepared for that resident of tomorrow who's going to enter their doors and have a lot of expectations as baby boomers. And then who are they selling to? The families of those baby boomers who they not only have expectations, they have demands
Mhm.
because that's how they communicate is through technology.
Speaking of the resident of tomorrow, you guys have had so much opportunity to interact with innovation across the full spectrum. Where do you see the trends changing over the next 10 years, whether it's from the operator side or the innovator side or both?
Well, that's a big question. I'll let Liz pick up on robotics because I know they do a lot of testing with robotics. But, we had spoken a little bit about artificial intelligence and, how do we get around the fear of what it could do that could be misinterpreted? And it should not diagnose, it should be a tool to help you. But now we see people on the internet that ask ChatGPT for a MD diagnosis. And it's based on the questions that you ask to the information that you get back. And so you really need to weigh the truth in it. And then, on robotics, Liz, you all are doing a lot of work with robotics, I know at Honor.
Yeah, Daniel, I believe trends wise, robotics is continuing to evolve. Again, how do we take some of those tasks out of human hands that we can then repurpose that human to be able to focus on, things that we need a human to do. And robotics is from a cleaning standpoint. So we're starting to see more and more move into, how can we use robotics to assist with the cleaning, and
Dining.
their CR on that, ROI on that, the dining side. And as Sherry said, how can we use robotics for use cases like delivery, even if it is things like delivering towels or sheets or items that you don't necessarily need a human to actually deliver. That way, all of the, care staff can really continue to work at the top of their license. Innovation trends are gonna continue to evolve. I mean, to guess what the next big one is going to be is a little difficult. AI obviously is gonna continue to impact what we're doing, but at the end of the day, senior living, post-acute care, healthcare in general, we need humans
Yeah.
to provide care. I also believe that the trends are going to evolve, as Sherry said, as baby boomers continue to move to these senior living campuses. Their expectations are very different than even, someone that was coming in 5 years ago, because baby boomers, they've all used technology for the better part of their life. Everybody has used email, everybody has a smartphone, everybody's, been using traveling with laptops and iPads and all virtual meetings for a very long time now. So when they move to a campus, a senior living campus, that expectation is going to be, I want all the technology I had in my house. Like if I'm going
Mm.
to move to this place, yes, it's beautiful and there's walking trails and there's pools and there's tennis and pickleball and golf and all of those things that everyone wants to do as well. But the wellness side of technology is continuing to evolve. And baby boomers have a big focus on longevity and wellness. And it's not just about living longer, it's about living a full life. And how does technology help to support them to do that?
Yeah,
Well,
because
don't you
older
think,
adults no
Liz?
longer. fall into that category of, oh, well, they can't use technology. Old people, they don't interact well with it. It's like we're getting a whole
Yeah.
new generation in that are a lot more mobile, a lot more tech savvy, especially in regards to you guys pick somewhat controversial technology topics, right? Like in the way that older adults react to them, like AI and robotics. They instill some fear in some individuals. My parents, for example, my dad is like, as soon as those Tesla robots come out, we're getting one. And my mom's like, hell no, I'm not having one of those in my house. So I imagine not only are you seeing these changing trends, but also there's probably a wider gap between how
Mhm.
comfortable your different residents are with the technologies that are coming out. That's gotta be very difficult to navigate.
And I think
Yeah.
it's culturally different too.
Mhm.
If you go to Japan or China, you go to an
Yeah.
Asian market and they're more apt to adopt robotics than we are here in the US. We have a workforce shortage, but they really have a workforce shortage because it used to be they expected the older daughter to care for the parents. Indian culture, they expect the older son to care for the parents. And so, as we've all become more of a mobile society and we're moving away and we're developing careers, what's left is some of the technology to care for us. And that's why in Japan and other Asian countries, they adopt robotics. Where in the US, I feel like we're behind times on robotics, but we also have a lot of regulations in the US that they don't have in other countries. But I think we're going to see, with the growth of the baby boomers, more of these senior living organizations stepping outside the walls of their organization and into the home.
Mhm.
And that's where I think you're going to see the technology become so important and the monitoring and trying to collect that data to care for that person in the home who may reside there till the day they pass.
Yeah, I know aging in place has become a huge thing. Even if you're talking about somebody who has moved into a lower level assisted living or independent facility, that facility has a vested interest in keeping that person aging in place there, right? So it's like all
Absolutely.
about trying to, prevent that person from really moving on to the next stage, which is better again for the older adult, but also, the caring provider, the family, and the operator.
Yeah. I mean, it's a bigger profit margin. And by the time you have entered skilled and at end of life, they typically are not getting reimbursed for the total cost of care. And that's just the reality. The higher the acuity level, the more care it takes, the more drugs it takes, and the reimbursement is not recovering that cost of care.
I believe it's really important too to think about as an operator, but also as an innovator. Although it's the older adult moving to this campus, they're not the only one looking at the campus. It's their children that are going with them, and those children might be in their 50s and 60s, but they've been using technology as well. So that child's expectation,
Mhm.
as Sherry said, the oldest daughter, which happens to be me, is also going to be looking at what is being offered at this campus versus the one down the street or the next town over. Healthcare is not what's the closest. Senior living's the same way. It's not what's closest, it's what's best for, my loved one and what's being offered. So that's something too, that's continuing to evolve, but we're the ones that are actually looking at the campuses with our parents and grandparents and older adults.
And you can bridge that distance gap with tech.
Mhm.
Yeah.
So speaking of that, I know we're running right on the edge of time, but I would be remiss if I didn't ask you guys, since you interact with so much innovation, is there one particular innovation that each of y'all have interacted with recently that got you really excited?
Oh gosh, lots of innovations. One of them we're bringing in here, who was on Shark Tank, is a product that can take a room that has no windows and create a window that works with
That's really cool.
circadian rhythm and your time zone. So when the sun goes down, it goes down. When the sun rises, you can see the sun rising. And, I actually had to judge them at a Senior Living 100, and they did not win. But when I talked to the founder of the company, I'm like, I remember the days when my mother was in the hospital and how they can go into hospital delirium. So you put someone in an isolated room without a window, it's like putting them in prison.
Oh, yeah.
And so I'm excited to get it in here. It's not in here yet, but it should be in here within the next 2 months just to see how that will work. I mean, we think of a lot of tech products, but something as simple as taking a common room or a room that has no windows that maybe a resident is in and creating that to be where they can look outside and feel like they're a part of what's outside those walls, I think is great for a resident.
That's very cool. I've never heard of that. So I'm impressed with that. Now, Liz, your job is you got to beat that one. And you got to
Oh,
come up with
geez.
something more interesting.
That's I was trying to think of something I've seen, but
Sheri gave you a tough job.
yeah, she did.
She knows that one too.
I know that one too. I was thinking the same thing. Like that one's a pretty cool one. I don't know that there's anything that's kind of blown my mind lately outside of that company. I am excited though about just in general the impact that age tech is having on older adults and senior living. It's such a great feeling to have worked in senior living for such a long time to see such a focus on our older adults and helping staff and our senior living operators, which I truly believe is a calling. People don't work in that space just for the money. They work in that space because it's a calling and they love what they're doing. And so the attention that Age Tech is getting now is just so exciting to me because we're taking care of and providing services to our older adults. And what better job could that be?
That's a beautiful note to leave it on. With that said, I know we're running out of time. So, for anybody out there who's interested, say they're an innovator who wants to get involved with the Thrive Center, or an operator who wants to interact with the technologies at the Thrive Center or CDW, how could the people out there get in contact with both of you?
For Thrive Center, info at thrivecenterky.org.
Yep. And at CDW, so I'm on LinkedIn under Elizabeth Cramer, and that's Cramer with a C. Probably LinkedIn's the easiest way to connect with me and happy to, have a conversation with anyone that reaches out.
You
Yeah.
also have any tandem panels or anything like that with AgeTech Connect coming up?
We just finished one here, the post
Yeah, yeah, you just did. Yeah.
and so I think there's one that Jeff is going to do at the Buck Institute
Hmm.
Mhm.
coming up, and so I'm
Yeah.
interested in attending that one. I don't know that he'll have us on a panel, but I'm very interested in attending it.
Yeah, I'll be moderating a panel at that one at September 18th, I believe is the date. So I'll be moderating a panel at that one. And then we've got a CDW event coming up in August as well. So Sheri, of course, will be very involved in that, and we'll have a number of panels for those as well.
Well, to the audience, you heard it here. I mean, everything that Liz and Sherry have talked about. If you're interested in getting more innovation on board as an operator or bringing a new innovation to market, definitely contact Liz and Sherry. Liz and Sherry, thank you so much for being on. I'm super appreciate it. It's been great. I guess everybody catch up with you guys at the next AgeTech Connect events. But otherwise, it's been great talking with you guys.
You too,
Thank
Daniel.
you.
Thanks for
It's been great.